to know you as a person. Rima, if I may ask you, what made you write this book?
So as Dr. Rajagopal said earlier, I live in the Boston area in the US now. My parents live in Delhi. That's where I mostly grew up. A few years ago, my father had two successive strokes, and that left him paralyzed neck down and unable to speak. So we were left in a situation where he was home, taken care of very well under the circumstances. My mother was the primary caregiver. I was the secondary long distance support system, along with many other family and friends. The one I had personally had a hard time dealing with the situation, and I started writing a diary on behalf of my father, trying to imagine what he must be thinking that he could not express, because he had a lot of expression and we interpreted his expressions, and that's how this process started as a diary. And as I started thinking about what he was currently thinking, the other thing one can think about is what happened in the past in your life. And I started delving a little bit more into his life and him as a person, beyond being a parent to me. So a lot of times we only think of our parents as, in that role. And I felt I had lost my opportunity to understand him more as an individual. So that's the genesis of this. It was a diary that I wrote and decided to publish actually many years after.
Moving forward from there, so you wrote that. It must have been a lot of pain and reliving suffering going through it.
I think it was painful to write, but it was almost more therapeutic for me to write. It made me, I think, connect with my father. It made me hang on to him. It made me appreciate my mother more as I saw her managing the caregiving process. So it was both. It was painful, but I would almost say the therapeutic aspect of it kind of dominated for me.
Many people have said that when they have gone through grief, it is cathartic to be able to discuss it. And some introverts who cannot talk it over with others find cathartic to write it down, even if it's not published. Just going through that, and maybe it helps people to come to terms with themselves, with the thoughts.
That was exactly what it was, because the decision to publish came like 10 years after I wrote it. And there were certain triggers that made me decide to share the story a little bit more. One was I felt that I wanted to share this story just to kind of empower and sensitize other people who are going through a difficult situation. So that's one. Storytelling in healthcare is I think important, and as I've gone through this process, I've learned more and more about how helpful it can be to share stories and empower each other as we go through situations. The second reason was that I wanted to share my learnings and observations from this experience that our family went through, and I have tried to kind of encapsulate that experience in what I call a 3R framework. The 3 R's I refer to are respect predominantly. That to me is the biggest factor in any such situation. The second one is resilience, which is just being able to, I can talk a little bit about it. The third one is realism. So respect, resilience, realism. Really quickly on those three. Respect is about dignity for the person. Respect is about honoring their independence to the extent possible. And respect is about just always understanding that as we get less able in our life, we are probably even more sensitive to how we are treated. So that is absolutely the biggest tenet for me, and that's what I saw and I learned, and I think that's what probably made my father's experience as good as it could be under the circumstances. The fact that he was not just physically taken care of, but he was also mentally stimulated. He was emotionally nurtured. He was part of the family till the last day he passed away. Um, Resilience is just the kind of the amount of courage you need, just the emotional courage you need to handle such situations. And you all see a lot of examples of resilience. We saw some today in the morning. And it's about showing up happy, creating a positive environment, being able to do that even when you're undergoing a lot of anxiety, pain, all of that. And realism is balancing hope with reality and figuring out what you can do and cannot do. It's like the saying in the Gita, there's a saying in the Gita in Sanskrit which says karmanyevadhikaraste, which really means we can only do what we can. And that's reality. So the third reason I want to share this, which is increasingly important to me, is I want to encourage people to connect with their parents, their grandparents, their family, the seniors in their homes, because I think it will enrich them and it will prevent them from regretting what they did not do, which is kind of what my situation was. I had a lot of regrets. So those are my goals in sharing this book and this story with everyone.
I think there's a lot of powerful messages for all of us. Respect, resilience, and realism. And today, in the last person that we saw on home visits, I saw my colleagues demonstrating that respect. And I saw that 73-year-old lady. Oh my God, the epitome of resilience and realism. She was talking about that. As soon as she started talking about that, my hackles went up. I wanted, my physician arose in me. I wanted to check if she was in depression. She was not. And I suppose what you are teaching us is that if we deal with people with respect, they might add with compassion and competence, they can be helped to be resilient and to come to acceptance. And something else that you mentioned, I don't know whether it reached all of us. That is not only important for the patients that we saw here, you were saying that's important for all of us. Nageshu, you were saying that's important for all of us. And maybe my colleagues are here. Rima expressed how she was helped by her father's illness to connect with him more and to connect with your mother more. And why do we have to wait till somebody is seriously ill? I wonder, do we all know how our parents spent their childhood? Do we know what all experience they have had? Do we ever wonder what was the greatest, most memorable experience from our childhood? What you are saying is that we should be initiating those conversations now, not waiting for somebody to be here.
Yes, yes. In fact, the phrase I like to use is connect, don't regret. It sounds very, trite, but, I truly mean it.
Connect?
Don't regret.
Because if we don't connect now, we regret it later.
I definitely felt that way, and I think a lot of us do. I've talked to a lot of other people who've been through these situations, and regret is a very common element in them. I think regret is key, but regret sounds like a very negative thing. So the thought is that while you have the opportunity, why not connect even more?
Rima, in your book, you talk about two speech therapists. One person is a speech therapist and nothing else. She concentrates on speech therapy. She is not concerned with the human being in front of her. The other person is a bit more human. I think for all of us healthcare professionals, there is a lesson there. Would you like to spend a couple of minutes on that experience with the two speech therapists?
So my father, when he woke up out of his coma from his stroke, the hospital, they started doing physical therapy a little bit just to, he was completely paralyzed, but just to keep some muscle tone, etc. And he had lost speech completely. So a speech therapist was called. And the speech therapist came immediately, said good morning, and then started giving him instructions. And she would say things like, say, ah. And he would he just looked, I still remember this, he looked at her and he just clenched his mouth. And he didn't even try to say, ah. And then she kept going and she would say, ba, say, just some random sounds she wanted him to make. And he absolutely refused. He just kept his mouth clenched. And then after that, every day when she would come, he would close his eyes and avoid him. And she would look and say, oh, he's sleeping, I'll come back later. But I noticed that he would do it consistently. His eyes would be open, but whenever she came in, he would close his eyes. So we finally realized, he couldn't speak, so we had to interpret his reaction. And I finally very tentatively asked the doctor in charge, I said, he's not responding very well to the speech therapist, and is there somebody else maybe who could try? And they sent another person who had a completely different approach, who came, pulled up a chair, didn't stand over him. This other first person would come and stand there with her clipboard. And he pulled up a chair, he sat down, he talked to him, he asked my mother where he's from, what his background is. Then he said, oh yeah, I'm from that same area, something like that. But the point is, it doesn't matter that he was from the same area. What mattered was that he asked those questions and, then started talking to him and then told him, answer when you feel like it. It's okay. And my father, you could see, was paying rapt attention and was very engaged and he still couldn't speak, but it was still different. This time when he said he didn't feel embarrassed by it because there was a level of comfort with that speech therapist which wasn't there. Because the first time when he opened his mouth and some weird sound emerged, I think he didn't like it and he just decided not to. So, respect, dignity, just these little things mean a lot.
The message that you're not a doctor or a nurse or somebody who provides healthcare. You are a consultant who helps the process. But you are not a healthcare provider. But I believe, Rima, truly, your book holds such important learning points for us. You have a lot messages to take in from that book. From all our patients, of course, from the lady who we saw this morning, but also from the book. Thank you for writing this book. It's a
Thank
very
you.
powerful.
Thank you for reading it. That means a lot. Dr. Rajagopal, I was wondering if you could share your thoughts. You shared a little of thoughts on this book. But are there other things that you want to share from your personal and professional experiences, a little bit, related to this topic? I talked about the 3R framework, respect, resilience, realism, leading up to your palliative care journey, and very, very specifically in your book. You say something which is very important, which is that health is not the absence of disease or infirmity, but also physical, social, and mental well-being. And what I your I kind of talked about my messages based on my learnings and observations, but your experience is so deep and so broad in this space. Can you talk a little bit about your a lot of your experiences? I know I'm in the book that you've written, Work with the Weary, but anything you'd like to share from that book or outside of the book?
What these people, our team, maybe something like 108 staff members and several hundreds of volunteers, what we are trying to do is to provide that healthcare that you quoted the definition of. It's the official definition. Do you know that the definition is almost as old as myself? It's only one area. It has been there. Nobody ever needed to think about changing it. Universally accepted. It is physical, social, and mental well-being. But we are trying to put that into practice every day. Maybe different aspects of it. I write about people suffering in the book, about the lessons that people teach us, which sometimes we refuse to take on. But essentially our message, our collective message together, is that all healthcare should provide healthcare. I mean, absurdly obvious statement that healthcare should provide healthcare. That statement is necessary because today...
And not sick care.
Exactly, not only care of the sick. Healthcare means that speech therapist pulling up a chair and sitting beside your father. Getting to know him as a person, which is essential. How can we treat somebody with respect and dignity if we don't do that? And Rima, work together. It may not happen in my lifetime, I know. But what everybody here and thousands of people that this team has trained will do together is to make that transformation happen. Make that transformation happen and make it visible. Abhirami is going to try to do it. She is very new. I don't know, maybe just a neonatal palliative care. But Abhirami is going to make it happen over a whole panchayat with her mentor who is going to be Babu Abraham. They are going to make it happen. So, what am I trying to say? I'm trying to say that we should be providing true healthcare. That we should be open to learning from the people that we care for. If only we pull up that chair and sit down, they will teach us. Thank you for asking the question and making me talk about my book.
Yes. So, any kind of last words from you? Any other questions? Any other areas that you would like to explore? So.
Rima, generally, this is not only about your book. It's about you and tens of thousands or possibly lakhs of young people in other countries worrying about their parents and their relatives in this country, generally the society is rather cruel to them. They are always criticized that this generation is like that, non-caring, leaving old people here, sending them to old age homes. They don't realize that the old age home is a luxury that are accessible to a tiny number of people. That lady whom we saw would not have that luxury. We all keep criticizing, but all of us have seen these young people in other countries going through terrible pain and suffering, thinking about their loved ones back home. The civilization that we created for them, the globalization that we push them to, force them to work there, look after their children, giving them an education, and keep worrying about the people here. How hard was it for you working in Boston and knowing that your parents are here?
So I think till the incident with my father happened, everything was quite nice, right? We would visit, they would visit us, so it was all good. And I think and you know, when your parents are middle aged, you don't think about these things. But as they get older, you know, they get physically more frail, their social life dwindles, their world kind of narrows, you know, into their home, literally. In my case, so that's what happens with a lot of people. You know, the parents gradually age, and then you know there's a balancing act between should they live there, should they live here, should they live independently, what's the right time to move in with your children, all those questions, right? In my case, because this was a sudden, acute incident. We had to deal with it really immediately. I have to say I had a lot of guilt. The guilt that Dr. Rajagopal referred to. I happen to be an only child, so I don't know if it would be any different if I had siblings, but what I learned from people, it is not about having siblings or not having siblings. You are who you are, and how you feel is how you feel. But that might have been a factor. And I had a lot of guilt about not being in Delhi all the time. So I used to go back. I was here through the whole for a couple of months, and then I went back, and then every 2 months I would come for 3 weeks. So that was my pattern. And while I was there, I would call every day and have a one-sided conversation with my father. But I would say the guilt definitely was part of the reason I wrote, because when I was there, I was trying to balance, live my normal life with kids and this and that and school and vacations and work, and that was a challenge to me. So that balancing act was very, very hard. So that's another reason I think I wrote, because it brought me back home. While I was writing there, it sounds very odd, because when I was so far away that that was another way of staying connected for me. And I continued writing actually after he passed away also for a few months, till I was done with writing whatever I had to write. So yes, long distance can be tricky. The one learning I have with long distance is that when you're long distance, you have to be supportive of the people who are actually taking care of the person. That is very, very important. A lot of us, when we're long distance, are second guessing, giving advice, kind of forcing our opinion on people. But whoever is taking care of them, whoever their primary caregiver is, whether it is your mother, your uncle, your aunt, your cousin, your neighbor, your friend, their friend, whoever it might be, professional caregivers, palliative care teams, whoever it is, it's absolutely that respect should extend to the caregiver as well. It's not just about the patient.
Thank you for giving that explanation, which will help us also to understand these children living abroad as well as the people living in this country, pining for them or pining for each other mutually. Rima, you have a way with words. They just flow from you. You know how to frame your messages well and to make it touch people here. I hope you will hold our hands. We are all on a long journey. We have far to go. Not quite knowing the way, sometimes or very often having to clear the bushes and make a path, sometimes being bitten by an insect and sometimes by a snake on the way. All this is part of our lives. We have some important messages to convey, but we do not have the right words to speak them with. That's where you will be able to hold our hands. Thank you. Thank you for writing the book and thank you for being a friend.
Thank you everyone for coming. Thank you Dr. Rajagopal, thank you Chitrana, Chandrika, I'm so sorry. And thank you everyone in the Pallium team for everything. And I'd just like to say one last thing which somebody said to me a couple of months ago while talking about the book and the story, and we were talking about she said, I don't like reading such books because they're depressing. And I said, they don't have to be depressing, they can be uplifting. And to me, that was my biggest learning. This whole process with my father, even though it could have become very gloomy and sad and, terrible, was actually an uplifting experience for all of us. In many ways, which I can't even describe. So the another quote from somebody who read the book, which I love. This is someone who actually works with stroke rehab patients, and she said to me, "What your book said, portrays is what I believe, that joy is always an option in every situation. In every situation." We can be positive, we can be, happy. Not like cracking jokes happy, but just, be joyous and grateful for whatever we have. So thank you everyone.
Thank you, Rima. We'll wait for your next book.